You don't know what you don't know.
This is clearly a pandemic. It's clearly an outbreak in the state.
No one knew what to do, how to do it. We were scrambling.
A man in his late 70s died on Sunday.
Patients were calling in scared. Do I have COVID?
This is a scary time.
How do I prevent it?
Our cases continue to grow in the state.
Am I sick?
The world turned upside down in March of 2020. A novel coronavirus had swept across the globe, sending millions of Americans into lockdown, and healthcare providers scrambling for solutions to a challenge they had never faced.
So much throughout this entire pandemic is learning where our resources are, learning how to support our staff, because it was overwhelming.
Serena Pettes entered the world of healthcare right out of college more than 14 years ago. Going to work for Loveless in their marketing department gave her the opportunity to serve the community through sponsorship programs like the American Heart Association's Go Red for Women campaign and other philanthropic endeavors aimed at keeping New Mexicans healthy. But as with almost every aspect of the field, the coronavirus pandemic forced her to pivot in her role and take on challenges she never thought she'd have to face in her professional life, coming to the aid of her frontline colleagues in a hands-on way.
I felt like a little helpless because they're so stressed out, they were so overworked, they saw such devastation in the hospitals.
Serena took on the arduous responsibility of advocating for her colleagues, making sure lunches were made, that donations were accepted and accounted for, helping to manage countless calls flooding in from scared patients. She also pivoted Loveless's marketing to education for the greater public, having to turn their messaging on a dime as new information became available daily.
People get excited with the amount of information that is accessible to them, whether it's through social media or ways in which people get their information. So that was difficult to try to keep people on the right path and follow science and follow the direction of what we were seeing and just giving the best information we could in the most timely manner.
With a cultural shift to online medicine being born out of necessity, Serena says she's grateful for the technology that has revolutionized how patients interact with their providers.
New Mexico is so rural, so the resources can be scarce in some of these rural areas. I think being able to offer healthcare in this new virtual world and this new convenience will really help where healthcare is headed.
Now, as we continue to navigate through the roller coaster of COVID-19, Serena has had the opportunity to reflect on the lessons she's learned along the way, attributing a large part of the journey to the various hats she's worn at Loveless.
I've been very fortunate to be involved in so many different areas of the organization. We're not Disneyland. They're not calling in because they want to book their next trip. They're calling because they're sick and they need help and they need resources. I'm proud of our community, and I'm proud of frontline workers, just in every aspect: healthcare, grocery store, drivers, my daughter's school, educators. I mean, just everybody.
At the end of the day, Serena is like everyone else: a wife, a mother, a daughter. Multiple roles that both demand her time and attention and engender the fire that fuels her work and her volunteerism.
Everybody has their own personal lives, and my mom lives here, and I wanted to make sure she was safe. My daughter was safe. At the time, my husband was, he's also in the military, so he's in the National Guard, so he was over in Fort Lee, Virginia, and so it was hard. It was hard managing everything here. And my team, I care about them deeply. So knowing that they were also going through some personal things, and I'm sorry, this was like 2 years in the making, but it's still, I'm very, very proud of my team. Sometimes you have to slow down to speed up. And we had to take a step back quite often to really learn and prioritize what was important.